We have two experience stories this month, which both relate to the end-of-life care we commission from Woodfield 24 Care Services, a not-for-profit social care organisation. Pauline Stevenson, a social care assessor from Cusworth, starts by sharing her thoughts on the care Woodfield 24 staff provided to a retired policeman husband, Bill, who died at home in November last year, aged 69.
Unfortunately, Bill had got bowel cancer, and we'd been caring for him in his terminal state for the last couple of months, and then it got to a stage where I was getting really run down. We'd got my 2 daughters and my 5 grandchildren helping. Bill were refusing to have any outside care, but then the Macmillan nurse came, Nicole, and she said, if Pauline doesn't get some help, she said this to Bill, if Pauline doesn't get some help soon, she's going to be in hospital and you won't be able to stay at home, Bill. So he relented and he agreed to some care. And then the carers arrived and they introduced themselves. What marvellous people. I can only say that they were angels. I just never knew that I could have so much help. And you know, I've dealt in the care sector and I have seen other care agencies, but these girls are outstanding. And they're more professional, they're finished off, you can see they've had good training, but they've also got empathy and that care inside in them. They're all, you can see they've obviously gone for a job because they want to do that job. And all I can say is I praise them and I call them angels, yeah.
Now we hear from financial advisor Dave Hall from Adwick Lee Street on how he made contact with Woodfield 24 and of the care his 80-year-old mum, Joan, is currently receiving from their staff.
Recently, a few months ago, her health deteriorated quite rapidly. The community matron had already made us aware that this was happening and gave us the warning signs, and had talked about Mum going possibly into an hospice or some sort of care support. Very quickly, Mum, who had been in a chair, became very, very immobile. I could support her on the chair, I could get her to the bottom of the stair lift, but then actually getting her to the toilet was quite an issue up the stairs. I quickly realised this was not good, so I put a call out to the community matron. Mum's health deteriorated that badly. I was waiting for the matron to come, so I decided that actually I'll stop work that day, let one of my sisters let the other family know, so they immediately stopped what they were doing, and so for a few days we were trying to cover it 24/7. After a week of that, I was almost at my wit's end. Anyway, the occupational therapist, what can I say, was absolutely tremendous. Stayed at home, and within 2 hours of phoning, bless her, goodness knows what the phone bill was like, we'd got my mum able to go into St John's Hospice, which again, tremendous place, and they were really good for a temporary basis. Occupational therapist then contacted me about having care, and St John's Hospice said, your mum can't go on without having a care package, which is when I first met the people from Woodfield 24. I met them and my sister did as well, and I have to say it was like a breath of fresh air, and I could feel the stress being lifted away, and they come in at set times. They're absolutely phenomenal, so professional, so caring as well. They are an absolute credit to NHS, and I was only then realised that actually they were relatively new. It'd been a new setup. It's not for profit organisation, and I'm just blown away by how good they are. What they've given us as a family is they've given Mum back her respect. They've given her back her self-esteem. She feels a little bit more back in control, not physically, but she can. Even when they come in and talk to her and ask her what she wants, she can talk to them. Mum's got good communication skills. She can tell them exactly, and nothing is ever too much trouble for them. You know, they must have the patience of saints. They've probably got more patience than I have as well, because I couldn't run around like they do, but they are great.
Brought to you by Doncaster Clinical Commissioning Group.